Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Med. Today is Tuesday, June 9th. So Fred, we're back.
We're back.
I miss David and Jason and Matt.
I miss them too. I miss you.
I see you every day though, but I still miss doing these with you for
yes,
sure.
Yes, absolutely.
We did this about a week ago, so let's pick up on the numbers. Let's begin with the graph that shows the 8 counties. The trend continues very positively, Fred. When we look at people in hospitals in those 8 counties of the capital region, we have 65 people being treated for COVID-19. A week ago, that was 82. Yes. And when we look at people who are currently in an ICU, in 8 counties, we have 6 people in the ICU, and a week ago, that was 10.
Yes.
So that's continuing. This graph here is another one you're familiar with. This is within the medical center itself. Let's go back 7 days. So in the last 7 days, Fred, we have had 18 people leave the hospital. 16 were discharged to home. 2, unfortunately, passed. So we had 18 out. We had 8 in. So we've come down by 10 from a week ago. That gives us 27 currently in the hospital. 24 are on the floor, 3 are in the ICU, and Fred, 1 is on a ventilator. And let's talk about the people in congregate living and those who currently are waiting to go back to the nursing homes.
So Dennis, we still have a large number of congregate living folks in-house. So I think today we have 11. Still positive who can't go. So that means our actively ill population is 16.
16.
And yesterday, to your point about discharges, we discharged 6 patients off of C2,
yes,
which has been one of our COVID floors. So we're about to turn that back to its normal function, which is colorectal surgery and short-stay surgery.
So when we have 27 people in the hospital who we're treating for COVID-19, that represents about 1 in 40 of all the patients in the hospital.
Small number.
So that means you can probably begin to even collapse down the units where we're treating these patients.
That's right, absolutely, and that is in progress.
Fred, there's an op-ed piece today in the New York Times. It's written by the leadership at the Cleveland Clinic, and they wrote about something that you and I have been speaking about here now for several months. And this is about people avoiding necessary care. And I think there was some really important statistics in there about emergency department visits.
Yes, and that's really been the focus, the change in volume in the emergency department. So nationally, there's been a 40% reduction in emergency department visits, which is just a huge number. And the corollary of that is those people that are coming in are sicker.
Yes.
Their acuity, which is the way we describe the severity of their illness, has gone up. Both of those are bad trends.
Yeah. So we're encouraging people, again, if they feel like they need medical care, seek medical care.
Seek medical care. Don't avoid.
As we talked about, we're going to spend now, going forward, a lot of these videos on things unrelated to COVID-19, which is very important, COVID-19, but other things we talk about are important as well. So let's begin with this today. So we're wearing shirts from the Department of Neuroscience and Experimental Therapeutics. For those who don't know this, in our college we have several different research departments which really do incredible research, and this is one of them. And they do work on neuroscience, and they work with strokes and seizure disorders and demyelinating disorders like MS. They work with dementia, they work with Parkinson's. They've received many awards, many grants. They have some great leadership in that department.
They do. Julie Politzis is the chair of this department. She's one of our neurosurgeons, a real rising star in the organization, doing some very interesting things clinically. One that's always caught my interest is using deep brain stimulation for depression, the treatment of refractory depression. Right. Julie's a functional neurosurgeon, so she works on improving the body's function through stimulation in the brain of various different types.
It's going to be fun to use this platform to highlight some of the great work we do in the college, in the hospital, and that's a great one.
Yeah.
Thank you to Eleanor Grind, who gave us these shirts. She's in the research department over there. Her daughter is very good friends with my daughter, so that's Anna is her daughter, and Maggie is mine. They're good friends.
Good stuff.
So thank you for that. Another thing we want to do in these videos is talk about people in the organization who have risen up into new leadership positions. And so today we're going to highlight 4, and I'm confident in the future we'll highlight many others. Fred, why don't you start?
So, in the middle of all of the COVID stuff that we've been dealing with, Bob Welsh retired.
Yes.
Bob was the
Bob.
Senior Vice President for Diagnostic and Treatment Services, so things like radiology in the lab. To replace Bob, we actually elevated two individuals in the organization, Mary Wilkes and Megan Wygand. And we kind of split Bob's portfolio, and then we added something into the portfolio. So Mary Wilkes actually has been a member of our staff since 1992.
Yeah.
Mary started as an ASA 5, and this really highlights the meritocracy that Albany Med is. She's risen up through the ranks, and as of April 1st, took on the role of Vice President for Ambulatory Services, which includes those DTS services that are more outpatient focused. Plus, she's working with Dr. Day in the practice and is the VP for Practice Services. Yes. Megan Wygand joined us in 2007, joined as a practice coordinator and worked her way up through the ranks as well. Was AVP for laboratory services, and then when Bob retired became Vice President for hospital ancillary services. So the portion of Bob's portfolio that's related to more inpatient activity, radiology, inpatient laboratories, etc. So two stars in the organization that have shown that if you work hard, do a good job, there's opportunity here at the medical center.
For sure.
And I think there are others like them.
There are. So congratulations to both of them, two incredible talents. Speaking of talented people, Michelle Cakeley has now been given the title of Comptroller and VP of Finances. She's also been with us for almost 20 years. She's a CPA. She's incredibly smart, hardworking, and she came through us through KPMG and has worked her way up. And we're so happy that she's assumed that responsibility as
That's
well.
Fantastic.
Another example of someone who's come up through the organization.
The meritocracy.
Right. And then someone new to the organization, but we'd like to welcome, is Flavius Toder, who's going to be the System VP for Supply Chain. Very important job when you think about all the masks and all the supplies that we need and how we've talked about the importance of trying to get them. He'll do that at a system level for us. Yeah. And he came to us from the Trinity system in Michigan, and we welcome him to the organization.
He has a lot of great ideas of how we can approach this from a system perspective.
For sure. Fred, let's spend a little time talking about some of the decisions we've made given the financial challenges that COVID-19 has given hospitals. That's been spoken about in the public, in the press. We've talked about that. We've had to make some decisions, and one of those decisions is about how we spend our money that had been budgeted for this year and changes we have to make.
That's right. So in the hospital, we had about $25 million budgeted for capital projects. Think of things like renovations, new equipment, that kind of stuff. And because of what's going on, we had to slow that down and in many, many cases stop projects and not spend that money. We have three fairly large projects that are important to the organization, and we will ultimately have to resume probably later this year or certainly in 2021. Our telemetry system is very old, needs to be replaced. Believe it or not, it's time to replace the video system in the new ORs that date back to 2013. And then the third, it's the pumps, the IV pumps. And we can't change just a few. We have to swap out 1,700 from a safety perspective. So some projects have been halted, others are going to be postponed, but we're going to need to be careful about how we spend our money.
And the important ones that have to be done this year will still be done this year.
That's right. Absolutely, Dennis.
Speaking about things that we're going to be doing this year, and let's shift gears and talk about clinical operations here. There's something called PDoc, which is provider documentation. And this is a way in which our providers who are caring for patients can document into the medical record electronically. And we've done that in certain parts of the hospital, but we're going to start rolling this out much more aggressively. And we just want to use this opportunity to say how important this is for the care of our patients, but also to thank some people who really made that happen. So, you want to start, Fred?
So it actually started to roll out yesterday in the pediatric world, so C7 and D7. So far it's gone well. I think Stu Miller and Alex Nagel both have been very important players, and shout out to them.
And thank you. That's absolutely true. And then Scott Van Sickle and his whole team, who actually helped write the program to allow this documentation to take place. This is a big step for us, and we're looking forward to it.
It's going to be good.
Lastly, Fred, something that is very important to both of us, and I know every time we have a chance to do this, we do this, and it's happening tomorrow. So let's remind our workforce about the opportunity.
So there's a blood drive.
Yep.
It actually starts this afternoon. It's up on the 3rd floor of the F building and continues all day tomorrow. For a host of reasons, there's a critical shortage of blood right now.
Right.
In the summer, that's usually the case, but then COVID caused many, many hundreds, if not thousands, of blood drives to be canceled.
Right.
So it's very important. Dennis and I both are going to give blood. We
Right.
do every time.
Every
They're
time.
here, and we would encourage everyone out there who can to do the same.
Absolutely. I know my brothers do too. I think my brother Kevin, I think, has given over 100 units. He's
Oh,
one of those
wow. Wow.
lifetime donors. So we'll do it tomorrow, and we encourage our workforce to do that as well.
Absolutely.
Okay, so this is how we're going to do this going forward. To our workforce out there, we hope that you like some of the themes we're talking about. We encourage you to reach out to us if
Yes.
there's things you want us to talk about on this Tuesday, Thursday cadence.
Let us know.
Let us know. All right, very good. So we'll be back again Thursday. So some things have changed and some things have not. So I'll always end by saying, please take care of yourself, take care of each other, and we'll see you Thursday.